7 أبد. إلا دار زايد لا تقرب حماها، لا تقرب منازلها إلا محب. زايد أسسها واليوثن وراها، داروا على الدانات 7 أبد. نحنا شعوب لها نفدى تراها، نبذل الغالي لها دوم ونهب.
نحنا شعوب لها
نفدى تراها،
نبذل الغالي لها
دوم ونهب. تاريخ لا تقرب منازلها إلا محب.
زايد أسسها واليوثن وراها،
داروا على الدانات 7 أبد.
Welcome everyone with your program Peels of Yunnan, who invade the most successful story and person here in UAE. Today from Dubai City with Dr. James Zachariah. Welcome, doctor.
Thank you, Dora, for coming to our home and taking this program.
We are so happy to meet you today.
Same here.
Well, doctor, today I need to do this perfect interview with you to know more details about this doctor here in UAE, this big name also in this country. Can you please introduce yourself for everyone?
Sure, Dora. Well, I started my journey from India. I am from India, on the east coast of India. Though my parents come from Kerala, South India, we grew up in Visakhapatnam, a coastal city in India, where I did my medical graduation. And after that, I went to a prestigious medical college and premier center in medicine, which is Christian Medical College in Vellore. There I had my, I would say, the basic surgical training under world leaders of fame in the college. After spending 3 years, I went to the other Christian Medical College in Punjab, that is North India, where I got my master's in surgery, and I was one of the distinction candidates from there. Following that, my interest was to work in what we called as a rural area, what we call as mission area, where people work with people who cannot come to the cities for medical care. It's more of a charitable place. My wife and I like to work there. But as things moved on, we came back to Visakhapatnam, that is our hometown, where I did private practice for almost 18 to 20 years, and I was working in a corporate setup. Following that, when I came to know that there is a new field in surgery, which is laparoscopic surgery, where we have make keyhole surgery, I went for laparoscopic surgery training in India as well as in Singapore. That is in 2010. Following that, I also was exposed to bariatric surgery in Singapore. And I met world leader Dr. V.J. Lee from Taiwan. It was only in 2015 that I went back to him and had a 1-year fellowship where I could train under his able guidance, and I was awarded the one of the outstanding fellow awards from Taiwan Asia Pacific Metabolic and Bariatric Surgery Center. Meanwhile, my credentials were also recognized by the American College of Surgeons, and I was awarded the fellowship of the American College of Surgeons in 2011. So that is where I started from. When our children grew up and both the girls went to college, we wanted a change of our work, so we came to Dubai. If you ask me why I chose Dubai, yes, one was basically my sister was here, so she was available. So if I need to go outside the country, my wife liked me first to go to where my relatives are. However, after coming here, I realized that we are having a world-class medical services being offered in Dubai. So I joined Zuleika Hospital as a specialist, where I went on to become the head of department, and that is how I came to Dubai.
some challenge for work for life. From your side, what's your challenge from the beginning?
Yes. Well, the challenges were the competition in medical field, the commercialization in medical field has impacted so much, because I started my journey as a doctor who wants to go and serve some of the people who cannot afford. That is how it started. But to be effective in modern medical care, we had to upgrade our skills regularly. So, I passed my medical or surgical specialization way back in 1992. So from that moment onwards, I have picked up so many skills as I passed on. So I would not have survived with that training alone. So at every level, I had to increase to laparoscopic surgery, advanced laparoscopic surgery, then bariatric surgery, then do research, work under other people. Even though I was, 50 years old, I still worked like a 25-year-old under a doctor. That was probably one of the greatest challenges I faced. The other challenge is in Dubai, we are having stars, world-class star, people from different countries like to come to Dubai, the doctors. So I could meet so many great people here. So to work with them or to work amongst that kind of a crowd was not easy unless we were upgrading ourselves every time and making sure that our patients are happy. And I have only one big asset, the good name that my patients give me and the relationship I have. The key point or key aim of my care was to see their problem through their eyes, to love your neighbor as yourself. Whatever may be the outward technicalities and professionalism, I always wanted and enjoyed that personal, connection that I have with my patient. And that is what my patients are happy about also. So in this age of all these advanced technology, I always fight that I should not lose my personal touch with the patients.
From your experience, doctor, I need to ask you about your opinion for the system medical in UAE, especially Dubai. What do you think about it?
I think the system is world class. It is perfect, as the Dubai Health Authority says. They want to make this as a health hub that is in par or even greater. I find that the regulations and the standards here are probably even greater than what we see in the US. My brother is a US hospital administrator in a big Valley Health Lab services. And discussing with him, I find out that what UAE has maintained as standards in some places is even higher than what medical care and standards are in the West. So that way, the high standards, and also holding all the medical care givers responsible for their treatment. In some countries, the medical care is given, and it is like patients have not got so much rights. They, whatever the doctors say, they follow. But here, it's a good thing that patients have the whole system supporting them. So it's more of patient-centric healthcare services in UAE. So I think that is very good for the patient. At the same time, I think the regulations are to be sensitive to the doctors who are coming from various countries. So they have to actually standardize that they have the care not reduced or altered by so many doctors who are coming from different countries. And so they have this high standard that is maintained. I think for the patient it is good. It is extra work for the doctors coming from outside, but it is good for the patient.
Doctors also here in Dubai have some good position. They take from the government a gold visa. They take also opportunity to work in the very famous hospital here. What do you think about this facility from the government of Dubai?
I tell you, I do not know how to express my thanks to the great leaders of our nation, Dubai, who have recognized what we do. And that is so rewarding. We feel like, giving our best to whichever profession, because recognition is the key for performance, I believe. So the Golden Visa has actually given us a lot of freedom. In fact, in my case, it has helped me to shift from a full-time. I was the head of department of Zuleika Hospital, Dubai, in surgery department. So this has helped me to have a better work-life balance. I have pulled out from a full-time to a part-time freelance job. So if because of the Golden Visa, I'm able to work in hospitals, and I'm self-sponsored. So it has definitely given us stability, and also this has given me confidence to invest into my assets into the country, because I'm going to be here for a longer time. So buying your own home or buying things here, this is all possible because of the Golden Visa.
Dr. James Zachariah is a fellowship-trained, certified, and an award-winning bariatric surgeon, trained under one of the world leaders in bariatric surgery, from Taiwan. He is also a fellow of the American College of Surgeons and has several other fellowships and memberships of international surgical societies. He has helped hundreds of obese patients lose weight through bariatric surgery and has perfected the art of hidden scar bariatric surgery that leaves no visible scars of bariatric surgery over the abdomen. He has over 30 years of surgical experience and has authored several research publications in high-impact international bariatric surgery journals. He presently practices in Dubai, UAE. His contact number is 0559123729.
So now we need to know more details about your specialty, doctor, from your side, sure.
Yes. In UAE, as I came first as a general surgeon, within a year I found out that the problems here are increasing on the side of lifestyle diseases. People who get heart attacks around 40 or 50 in other countries, young people are dying at 25 with heart attack because of bad lifestyle, and whether it is food, obesity, diabetes, blood pressure, or other things like smoking and things like that. So this is becoming increasing every day, and we see statistics going up. So that was one of the motivators also for me to focus more on this field called bariatric surgery. Bariatric surgery is a field where we do operations in the stomach and intestine to reduce the weight and the adipose tissue, that is fat tissue in the body. So this is not a surgery where we are removing fat from the body. It is about operating in such a way that the stomach and the intestine are adjusted in such a way that the food is not completely absorbed into the body, or we take smaller quantity of food. So this is what happens in this surgery. So this has created dramatic and good results in the patients. Not only that they are losing weight and looking good but they are also finding that their diseases like diabetes, cholesterol, blood pressure, snoring, sleep apnea, snoring, leg pains, back pain, fatty liver, even infertility due to polycystic ovarian syndrome, all of them are getting treated and they are becoming better in their health. In fact, the wellness is increasing after bariatric surgery. So that's why it is so exciting to see how, so I consider myself as a life-transforming surgeon, because this surgery really transforms lives.
So, doctor, I have a question about the Outstanding International Fellow Award. This one have some story about it.
Yes, it is. Well, yes, Dora, this is a very special experience for me, because I know that we were all competitive and working when we were young, but after you have crossed a certain age, you just want to go on with life. But when I was 50, I went for my fellowship, which is a big thing for me. And my boss was a Chinese Taiwanese, Professor Wei J. Lee. So by the way he trained me, it was so difficult because I was treated like a junior doctor, and he was strict with me. There were times when I thought I cannot continue like this. But by God's grace, I would say that I could work through it, worked hard, and he gave me a lot of difficult works to do, especially writing papers. And somehow I worked so hard that my paper, which I worked for almost 1 year, they could not get it published for almost 7 years. They had a lot of data of this bariatric surgery. They could not publish it, and I was one of the persons who could publish it. So the entire team was very happy that their entire hard work data was published as a good journal publication. So as a response to that, I get this call and says, James, we have honoring you with the award, and called me to Taiwan for a ceremony, and there was a cash award, and also this thing which probably has some gold somewhere, I don't know. I just kept it like this, from Taiwan. So it's an outstanding international fellow award in 2015, awarded to me on 2016. It's a very special award for me. I keep it in front of my table because of memories of all that I went through that time.
The last operation in this sector, doctor, about how to lose weight fastly and don't this weight come back for the person. Which one?
See, thing is, there is a clear guideline, world guideline, and it's very simple to follow. You know, our weight, some people may weight 120, but if they're tall, that weight probably is not too bad.
Yeah.
Or not 120, maybe 100. So there is a formula called body mass index. So this body mass index is a ratio of our height and weight. So normal should be around 25. Remember, 25. Below 25 is like slim, thin bodies. Above 25, weight increases more and more. But when a person's body mass index becomes more than 30, then it starts affecting their health. It starts affecting the liver, pancreas. They are prone for blood pressure, sugar problem, increased cholesterol and all that. But when it goes to 40, 40 means it is going to affect their lifespan. That means their life will reduce by 7 to 14 years, their lifespan. So if anybody is above 40, they should have surgical treatment. No diet, no lifestyle will ever help them. Between 35 BMI and 40 BMI, if they have any of the illnesses, then we offer them bariatric surgery. So if anybody is below 30, then we ask them take only diet and lifestyle. So according to their BMI, there are guidelines. So we know that there are many diets, many internet programs that are showing for, because weight loss industry is a multi-billion-dollar industry. But effectively, when you find that after 35 BMI, none of these things work permanently. All of them succeed for some time, and again they have rebound. So that is why bariatric surgery is one of the best options if your BMI is above 35.
Doctor, the person that they do with the operation for lose the weight, but they don't change the lifestyle of food or for gym, everything. They can start from the beginning?
You know, Dora, when they know that their operation is helping them and they are losing the weight, they develop positive outlook to life. They find that they can, because most of the, for example, women who are fat and sitting at home, I mean, those who are obese and those sitting at home, they're ashamed of coming outside. They're not even wanting to go to gym, and they know if they walk also they have knee pain. So they are frustrated that whatever they do, it is not helping them. So that is why bariatric surgery brings down the weight. Many of them lose weight 8 to 10 kilos in first week. And they start losing like that for 10 to 18 months. They keep on losing weight till they come to baseline. So when they see weight is coming down, then they start also using lifestyle, exercise, diet, because they know what they are doing is making a difference also. So I will tell them that you don't have to work and work out desperately, but that will tone up your body. It will give you healthy lifestyle, and overall improvement and the success of the operation also is better with those who are adding diet and lifestyle to the surgery.
So, doctor, now about the technology. This technology now it's in our life, everything in our life. For the medical system, the technology is very important now for all doctors.
Yes.
From your side, how you use this technology?
Yes. As I told you, in my surgical field itself, there is so much of technology that has helped us. Previously, when I started my operations 30 years ago, we used to make big cuts, long cuts, open, do all with our hands, stitching with our hands, close with big stitches. Women had such big long stitches, or men. I mean, whatever surgeries had long, which is scary. And patients had to be on bed for many days, and they could not go for work for even a month sometimes. Now technology has made it all very simple. They can get out of the bed 1 hour after operation. That is a big technology. That is one thing. Second thing is all the latest ways by which we are able to see inside the body through the small holes. Technology of endoscopic technology. Now, another thing which I want to bring it up is the artificial intelligence that is coming up in technology of medicine. This is one area which I want to just mention, that it is good as long as we don't lose patient-doctor relationship. What is happening is artificial technology should never substitute relationship between doctor and patient. This is my take on that. So if you ask me about what is technology, technology should always assist the person who is doing it and also the patient, but should not remove the connection, because I believe that connection between doctor and patient is a very important part of healing. Someone said, whatever may be the technology, the touch of the human hand is something which is no substitute.
Doctor, after this big experience for you in this sector, to be updated in all information is very important for the doctor.
Yes.
Every day, every minute.
Absolutely, because otherwise my patient will tell me what is the latest, because they're always Googling.
Yeah.
So Google and other internet things have made the information so available within seconds to the whole world. So I'm not saying that is the reason we should update ourselves, but it's a different world together now. What was 30 years ago, 20 years ago when I was training, and now it pushes me, which is good, because it makes me more active to go and find out what is the latest in my field. Medicine when we started was small, but different branches have come out, sub-branches, sub-specialties have come out, super specialties have come out. So as doctors, we are now keeping pace with our specialty. As you know, I started off as a general surgeon. General surgeon is general, everything we do, operation. But as we passed on different, years, we know that we can't know everything about every field of our surgery, general surgery. So that was why I went on to focus myself to smaller, and now I've come to bariatric surgery. So that is why I can keep checking my journals, going for regular conferences, present papers in the conference. I have presented several papers, both in the journals as well as international conferences, Korea, Austria, US. So all these places, we learn from other people also. And Dubai being the hub, everybody likes to come to Dubai. All the doctors, at least from my bariatric, they all like to have Dubai conference. Why? Because they meet, it's a central place, easy to travel. And so we are so blessed, I would say, to have exposure to all these world leaders whom we only saw in pictures. They are coming here, they are giving their experience. So that is how we are able to cope up with the advances and give our best. So any advance in the world, I'm sure Dubai will definitely get the first, whereas in other countries it will take some time for it to come down. So because of the standards of care, availability, and also the interest shown by the leaders.
Yeah. If I ask you, Dr. James, about your dream or your future plan, what do you think for the future after this big career?
To be frank with you, my future plan is very much connected to my initial dream. My initial dream was to take these technology and services I have learned, innovate it in such a way that people who cannot afford to come to a place like Dubai, even Dubai citizens, many people cannot afford bariatric surgery because it only insurance people can. Others have to pay a lot. So to make it available for other places, not so I would say lucky people, so that diabetes does not look at how much money you have in the pocket. Anybody can get, poor people can get, rich people can get. So my dream, if you ask me, I want to make sure that this field of bariatric surgery, which helps especially diabetics to get cured, that will be available for other people through innovation. So I really want to innovate such a way that it will be easy and it will fit the affordability of a person, let's say in India, or a regular person. Only the rich, if they get cured, the other people will die of this disease. So that is one of my dreams. The other thing is to make sure that we spread this news. Many people are afraid of this operation. So to have more exposure, teaching, and especially children who are growing in this new age are not being given enough of information regarding how they can prevent lifestyle diseases. So starting some health programs by which children can, from the beginning itself, control their diet, avoid diabetes, avoid obesity, because we see this adolescent obesity is increasing so much even in our own nation, UAE.
Dr. James, today you are a good name in your sector. So for the new generation, for the doctors that they have this dream to come to UAE, what can give him like advice or to support him with this message?
So if I need to advise those people, young doctors and qualified doctors, to come to UAE, it's a very great place. And I'm sure in the coming days we are going to have world-class hospitals, many of them opening up. So I believe there'll be more employing opportunities. But the important things I want to share with you is, number one is to get qualified by the best standards you can get, number one, which will help you, your employability. Number two is to get good experience, at least 3 years of experience in your own country, and be confident in giving that particular care you are trained to give before you come to this country, because this place you are directly taken up as a specialist, and then your impact, employability, everything will be better. And after that, you just have all the potential to develop into a very good healthcare giver in this country.
Thank you so much, Doctor. Now we need from your side also to speak about UAE, a message for this country who give us opportunity in all the sectors. So message from you to the government of UAE, also for all leaders here in this country.
First of all, I must express my gratitude and thanks for the recognition, for the facilities, and for your understanding about our healthcare. We remember even during Corona how we were supported. So first of all, I want to thank the recognition that doctors have received in UAE, and the high standards they are maintaining. I really appreciate the top class standards that all the hospitals are bound to maintain due to good regulations in place, which is good for patient care. So this also motivates us to keep ourselves, fresh with all the, to be competent and to be available and to cater to that standard. So this combination is one of the greatest stimulations, I think, to work and to continue working. And I'm happy that I'm here by the blessings of the government to continue my career and prosper. Thank you very much.
Thank you so much, Dr. James. We are so happy to meet you today, like a great example here in UAE. Thank you so much.
Thank you, Dora. You've been a great team.
So thank you so much, everyone. See you next week with a new program, Pairs of Union. See you. Bye-bye.
دبي تعطيك امان وظل القياده الرشيده اللي فيها، اللي هي حببت الناس والعالم كله في هالبلد. فانا بالفعل فخور بنفسي وبفخور بهالدوله الطيبه.
لبناني، انا شخصيا ابن مصر.
قيام على البلد ليل مع نهار، تركيزه، ما كنا وصلنا للي وصلنا.
أنا والله من عمري 5 سنين وأنا تحت البوش، وهذا يعني اللي ما له ماضي الله يرحم أبوي زايد ما له حاضر.
فاليوم الكل عايش سواء موافد أو مواطن، نحمد الله سبحانه وتعالى أن نحن في أمان وفي استقرار وفي أحلى، يعني وين ما تروح تلقى أنك أنت بين أخوانك وبين أهلك وبين ربعك وبين عشيرتك وبين الجنة.
منازلها إلا محب زايد أسسها واليوث وراها داروا على الدانات 7 أبد إلا دار زايد لا تقرب حماها لا تقرب منازلها إلا محب زايد أسسها واليوث وراها داروا على الدانات 7 أبد نحنا شعوب لها نفدى تراها نبذل الغالي لها دوم ونهب
نحنا شعوب لها
نفدى ثراها
نبذل المال لها
دوم